welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is the midwife who was present at the birth of my son, Carole Shipman, and we're going to be speaking about the difference between hospital and home birth. Carole is a nurse midwife, a mother, and a grandmother, and she loves catching babies and caring for women and their families. She's so appreciative of the privilege of being able to attend home and hospital births. She's been serving families for almost 30 years. You can find her on Instagram at Gentle Heart Midwifery Official and her website, Gentle Heart Midwifery. Hi, Carole. Welcome to the show. I'm very excited to have you on today.
I'm very excited to be here. Thanks, Laura.
So this is a really cool, special episode for me because you were the midwife at my home birth, and that's a really unique place to hold in my heart that you were there helping me bring my son into the world. So I'm just thrilled to have you here and have you share your knowledge about birth. And we're going to talk a little bit about the difference between hospital and home births today.
Yeah, that's great. I mean, I just feel like your birth was you had such a beautiful birth. It went it went so smoothly. And I'm just, it was as home births go, I think, and not that it was textbook, but it was really, really beautiful how everything played out, and you had really good support too also. I mean, I think your doula was amazing that you had there too with you. So
yes, and that's so important. It's funny, I have a lot of women in my office coming in when they're pregnant, and there's still a lot of confusion out there about what's a midwife, what's a doula. People sometimes think they're the same thing, and I'm having, to explain and educate like the differences. So maybe you want to spend a second actually talking about that.
Oh, sure. Yeah, I mean, I've come across that also. I've said to people I'm a midwife, and they'll say, oh, yeah, I know my friend. Yeah, she's a doula too, So I get that also. I have a good midwifery friend who's a home birth midwife. Also, and her way of looking at it is, I mean, I don't know if this sounds kind of smug or not, but she said the difference is 6 years of education. Because she says that, I mean, a doula, I have, a doula is basically there to give support and comfort to the woman, and also to guide her through the process. And, and then to really be that support person for her. I mean, they can still have a support person with them, like their partner. But the partner usually, the doula does have knowledge. She does have knowledge of normal, natural birth, childbirth process. And some doulas are also like lactation counselors or such. So they do have a really broad background. And they're basically, like I said, support person. Now, the midwife is your keeper of normal, I guess I would say, that we're there to try and maybe be more in the background during the labor process and allow you to labor as you need to labor physiologically, and not to hinder the birth process, where and then to be there to catch your baby and to and if there is medical intervention that's needed, to be there to do that intervention and to know when things are not right and when medical intervention needs to happen. Myself, as a home birth midwife who also has hospital privileges, I have the reason I got hospital privileges was so that I could transition a woman from home to hospital if need be. And then she would have the same care provider and not have to then, if most home birth midwives just do the home birth and then they go into the hospital, if the woman needs to go into the hospital, then they have to turn care over to a doctor or whoever is at the hospital. Yeah, I mean, I'm sorry. I think I got a little bit more off on
Yeah, but there's that continuity of care. And, it is quite unique. We were talking before we started recording. A lot of midwives either just work in a hospital or they just work in a home setting or maybe also birthing center. But it's really cool that it sounds like you started off doing the home births and then recognized that you wanted to get those hospital privileges for the times that women do need to transfer for medical reasons. And I also know you do have some clients that only wanted to have a hospital birth, right? They want a midwife delivering their baby, but they don't want to have a home birth.
Right. I mean, that's true. I do have clients that come to me that just want hospital birth. And I believe the reason they come to me too for that is that I do offer really good one-on-one care. And even with my hospital clients, because I have a small practice, I do guarantee to them that I will be with them through the whole process. I mean, I've had women in the hospital that have had long inductions. I've been there with them 24, 48 hours. I stay there. I sleep there. I don't. I make sure that, I mean, in the hospital, the nurses are doing the nursing care that I would do at home for someone, but they take care of that. But I'm the only one that is like orchestrating like how things are going to play out. And I'm writing orders and doing the checks. Like if somebody has a doctor in the hospital and they have a doctor, then the doctor usually has the nurse, like they just come in to catch the baby. And the nurse is doing everything and doing the checks, like to see how far she's progressing and then calling the doctor and letting them know. Whereas I do all my own checks and you don't have, and then there's no change of like shift type of thing. I mean, with the nurses, but not with me. So like I feel like I know what's going on. The woman knows me and she knows how everything's going to, like we already have a relationship and we're traveling on this journey together. Even if it's a journey in the hospital, we're still traveling together.
Yeah. And that's really unique. I think it sounds so simple and basic, but what you're really speaking to here is this beautiful relationship you've cultivated with a woman during the prenatal phase with all of her prenatal visits. And then you're continuing that during her labor and then for delivery. So there's such a trust factor and a safety factor that you're cultivating with that journey that I feel like is essential or really helpful for a beautiful birth experience to occur.
Exactly. Yes. And like my prenatal visits are like an hour and, you're really getting that time with the provider. And I do have women that have come to me that, especially I just had a birth last Friday night. And this particular client had hospital births prior. And she did have a hospital birth this time too. So this was her fourth hospital birth, but she had been with a physician last time. She'd been a physician with all three of them, but she'd been with a local physician last time. The other two were in New York. I'm in New Jersey in Hillsdale. So, with her other experience, the reason she came to me and she brought her doula with her for her first visit was because when she had the baby in the hospital last time, she got there 2 centimeters dilated and baby number 3. And the nurse checked her and the nurse was like, okay, well, you're only 2 centimeters. You can go home. And she said, no, I'm going to have my baby. I'm going to have my baby. I need to stay. The baby's going to come. I need to stay. And then she said she must have had 3 other nurses check her and everybody was telling her she needed to go home. But she insisted on staying and she did stay. And really she had her baby like an hour and a half later. And she was and her doctor wasn't there because they didn't call her doctor to come because they kept saying, no. And she told me her experience and she tried to talk to the doctor. Now she came to me halfway through her pregnancy this time and she talked to her doctor and she was trying to talk to her doctor and she just couldn't get through to talk to the doctor. And because she was having not nightmares, but dreams about her experience last time and how she was so upset, and she was having like, she felt like almost, I mean, PTSD is thrown around a lot, that word, but she was traumatized by her last experience.
Yes, and definitely disempowered. That's definitely what I'm hearing from that experience. This is a woman who's gone through birth. She was experienced. She knew her body. She trusted what was happening. She communicated that, and she wasn't, they didn't believe her.
Yes,
and
she was
disregarded.
Yes.
Yeah.
And then
this is a common story, right,
Yes.
Carole?
Mm-hmm. Yes, this was very, this is what happens. And this time with her birth, she came in, and when I first saw her, she came in, she's like, I'm going to have my baby. And I thought that maybe we're going to have a baby right away. So we got into the nearest room. We were going to go down to room 6 because there was a tub in there. But the way I thought maybe we should just go into room 3, and we went into room 3, and I checked her, and she was 3 centimeters. She stayed, and literally, I think, let's see, she got in there about 5:15, 5 o'clock, and she had the baby at 8:06 p.m. So within 3 hours or less of coming in at 3 centimeters, she had her baby. But like, I was there. She was there with her doula, but and I was there, and she didn't want a lot of people in the room, and there wasn't anybody else in the room except for doula and her husband. And I came in periodically, just checking in on her, and then at one point, she said to me, "The baby's going to come soon. I really want you to stay in the room." So I was like, "Okay, fine." And she was 8 centimeters then, and then within a few more minutes, she said, but she was pushing her baby out. So it just did happen. And I knew the story. So I was prepared. And that too, I think having the same practitioner is, I knew her story. I knew her history. I knew that, that she knew what was going on with her. I mean, I know that anyway about women, but I mean, particularly in this case, that I wasn't going to, when she said, just stay in the room, I stayed in the room, and we had a baby.
Yeah, it's so simple. And, she felt heard and seen and respected by you, instead of just saying, okay, I'm out, I'll be back. You're 8 centimeters. There's 2 more to go.
Right. And then she was and she did tell me afterwards, because we talked, that she said that she felt like this was her most peaceful birth experience that she's had. And this is her last baby, baby number 4. She said, this is my last baby, and I feel like this is the most peaceful birth experience I had. And one of the things too, like, since we were talking about doulas, is when her doula came to that first visit with me, she did say, the woman was talking about her experience, and the doula said to me that was the same way that she had experienced the woman's birth also. And she said she hadn't said anything to her about it because she didn't want to infringe or bias her based on the doula's experience. But then when she said it, the doula was so thrilled that she had come to me, and so thrilled that she had seen the birth experience the same way, and that this time she was going to have the opportunity to, I guess, rectify things too within herself.
There's a healing that occurs for women with subsequent births when they go from disempowered to empowered. And that's what I'm hearing happened in this case. Did she want to have a home birth? Was it a transfer?
No. She had wanted to come to me, like you had said. I have people that come to me for hospital births. I mean, I felt that she would be a perfect candidate for a home birth, but that's not
your decision.
What she was at. Right. Yeah. Exactly. So, and as far as hospital births go, I believe she had the best possible hospital birth experience that you could have.
So let's talk about that. Let's talk about, if a woman is thinking about, where do I want to give birth? Do I want to give birth in a hospital? Do I want to give birth at home? Birthing center. Can you just talk a little bit, elaborate about what the difference is between these different types of birth locations?
Okay. Well, some women too are not, we want to keep home birth safe. So we really just want to deal with low risk women.
Yes. So let's talk about what that means.
Yes. Okay.
Like, not everyone's a candidate for a home birth. And I think what I always share with women, because for some reason, there's this fear, like, how will I know? I'm like, because you have a birth provider, a medically trained certified nurse midwife who knows if you're a candidate or not. That's your job, is to determine if they're a candidate. And if they're not a candidate, you're going to communicate that, and you're going to get them into a hospital or transfer them to the care of an OB if they have, certain risk factors.
Right. Yes. With the things that would make a client home birth or risk them out would be high blood pressure, hypertension, diabetes, like insulin dependent diabetes. I have had occasionally, I think, maybe once or twice, a client that was gestational diabetes, diet controlled. I mean, the baby, I remember she was a yoga instructor and she was having her second baby, and she, her weight was good. She was watching her diet. Her blood sugars were normal. Like that she was a healthy gestational diabetic, and her baby was even smaller. And I believe, too, that she got that diagnosis, if I remember correctly, because I said to her, next time, we really need to look at this a little bit more. Like from the get-go, she's with her diet and everything else. And she had a history of her first pregnancy being gestational diabetic. So I believe that, because she came to me later in pregnancy, too, from another home birth midwife who's allergic to cats. And she had 2 cats. So that's why she came to me. So I'm, like I said, I'm probably a little foggy on exactly the diagnosis, but if I remember correctly, it was something from a previous pregnancy that they just assumed would be the same thing this time. But anyway, so she had a home birth. But if you're insulin dependent diabetic, if you're have hypertension, if you're anemic, because, there is bleeding after birth. So if somebody's anemic, you don't want to have them have a home birth, just because if they're bleeding, they could lose, it could be very consequential. I'm just like off the top of my head here.
That would include like preeclampsia. I know that's related.
Yeah, that would be, preeclampsia, which would be, with the blood pressure issue and spilling protein in your urine.
Did you know that there's an organizing app designed just for families? If you're starting to feel busy again, and I know I am, and your calendar is jam-packed with events and kids' activities, why not do yourself a favor and get Cozy? Cozy is the #1 organizing app that families use to juggle school schedules, practices, meetings, doctor's appointments, and even a workout or date night. With Cozy, you'll be all set up to know everyone's schedule, who's doing what, when, and where. And Cozy will even send emails every morning with the day's agenda. No more missed pickups or double bookings. Here's how it works. Cozy tracks everyone's schedules and events in one place with a shared, color-coded calendar. Cozy even reminds others about events so you don't have to. It's easy to get started. You can pull in events from your family's personal work and school calendars. And the best part, it's free. Just download Cozy Family Organizer from the App Store. That's COZI to get the free app today. I know I've been using it and I absolutely love it. And certainly going into labor before 36 weeks?
Yeah, 37. Home birth is 37 to 42. At least, for my practice is 37 to 42 weeks.
So if you're, outside of that range, then you probably need to be in a hospital.
Yes. I mean, and then also, if there's any issue with the baby or the placenta or the cord, there can be, recently, someone had 3, I think it was 3 home births, and she now had hypocoiled cord, which could be a complication during labor. So with that, she did have a hospital birth with me. And as a matter of fact, her last home birth was really not a home birth, but something that arranged that she had the baby in my office 5 years ago, the previous baby, planned that way. And then this one she had at the hospital because of the hypocoiled cord. So, and then I do have another client now who just got risked out of home birth for a complication with the babies. the baby has a heart defect.
Yeah, if the baby has some congenital issues, they need to receive medical care immediately after birth. So they need to be in a hospital. Hospitals are for emergency medical care, right? And so like if you have either a mom or baby that needs that, that's the best place for them to be.
Right, exactly.
But would you say the majority of women are considered low risk?
Yes, yeah, the majority of women are. Yes. Yeah, I think sometimes we think that women are sicker, or, we're trying to look for more things. I mean, I guess I should say too that I don't risk women out of home birth at 35 years old for AMA, which is something that, yes. So I have had women that have been 40 years old having their first babies who have had beautiful home births. So
Carole, tell me, what is this AMA? What does that mean?
Okay, that stands for advanced maternal age. And in the medical community, it's felt that any woman that's 35 or older is advanced maternal age. I mean, you'll even see on the ultrasound sometimes, like they're a geriatric patient, which is ridiculous. As far as I'm concerned, it's ridiculous.
Me too. I think it's disrespectful, actually.
Yeah, I believe that women, I've had women that are 40 years old that have had the home births, and they had their first babies at 40 and have had beautiful home births.
Yes.
So I really think that that's, if a woman's healthy and everything is fine with her and the baby, there's no reason to preclude women from having home births or natural births. I mean, even in the hospital, I did have a client that came to me later in her pregnancy also for a hospital birth. And the reason that she came to me was because her doula had just recommended that she talk to me. But the thing was that they were having her come in and do like all this extra testing starting at 36 weeks to do non-stress tests, biophysical profile, plus a visit with the doctor. And they just because, and she had had a baby 2 years before. A normal vaginal unmedicated birth. And now, just because now she's 35, then now we have to go through all this extra testing just based arbitrarily on her age. And
yeah, that's so crazy.
Right. And it's very difficult. I mean, this for her too. I mean, she's working, she has a 2-year-old, and now she's got to come for 3 different visits. Like it couldn't even be done like they couldn't even coordinate it together. It had to be like 3 different times she's coming. I mean, as a midwife, I see them because things can arise at the end of your pregnancy. So I would see the woman every week. I see all my clients, irregardless of age, every week starting at 36 weeks, just to see, do blood pressures, weights, and, listen to the baby and just make sure that there's nothing going on. I don't believe that all this extra testing is necessary, unless it's warranted, unless there's a concern. But just because somebody's 35 years old, it's just, it just seems, and this is something new. This is like, we keep adding on more and more things and more testing and more, and that's, and the way the insurance company would pay for this is like, I think that that's part of it too, is that they're willing to pay for the more testing and everything else if somebody's advanced maternal age.
That's so ridiculous to me because, in general, insurance companies should never dictate medical care. And I do see that sometimes, like if a test isn't covered by insurance, then a practitioner is less likely to recommend it for that reason. And it's like, well, no, you need to have informed consent here. And as a practitioner, your knowledge of what tests are recommended and why they're recommended, irregardless of insurance coverage. So there must be some CYA thing going on with what you're mentioning. Like, okay, there's this textbook written saying insurance says, okay, this woman's older than 35. therefore she's high risk, and therefore high risk pregnancies need more tests.
Exactly. And it's arbitrary. It's not based on the individual. That's what I find with medicine. It's like, it's everything, everybody, we need to like put everybody in a box. Like, this is what it is and that. And instead of looking at the individual, and I think that's what's missing in healthcare all the way around. And that's what I feel like as a midwife practicing the midwifery model of care, it is about the individual.
Yes. And that's really ideally what all medicine should be about, right? Because we are all are individuals. And specifically, we're talking about pregnancy and birth here. What I even see in my practice, the same woman, the same individual can have different experiences between different pregnancies and different births. And so like you had in that previous story, you mentioned a woman kind of bringing her gestational diabetes diagnosis into a future pregnancy is so strange to me because it's a different pregnancy, so why would that label, be sticking around? It just, you have to really have a fresh slate for each experience and, look at what does this individual need? What does this baby need? This is a different baby, different pregnancy. There's so many factors, with multiple pregnancy, the woman's now since her first, or she maybe had more time to exercise or rest or have self-care. Now she's caring for a toddler, 1, 2, whatever. And, there's different things she's juggling in her life at that moment compared to previous pregnancies. So, we have to see what's warranted at that moment.
Right. Exactly. And, the individual care, I think, is the most crucial part of it, and maybe coming from a home birth perspective, and even with my hospital clients, I still provide the same prenatal care. I still I'm able to give them that individual care that I give, to my home birth or hospital clients. So I just look at them as an individual.
And, this is so unique. You're spending so much time with these women during their prenatal visits that they'll never get that typically from an OB practice. And I think a lot of that, once again, is why is the time less? It's because they're, in network typically, right, with insurance, and that therefore warrants a high volume practice in order to cover overhead. And I think that sometimes people don't understand when practitioners choose to be at a network, it's because they want to spend more time with patients and they don't want their care dictated by what's covered by the insurance.
Yeah, that's exactly true. And even when you think about how women are treated when they go to these high volume doctors' offices too, in that they sometimes are waiting because they are like double and triple booked,
right?
And they're waiting for like 2 hours to see a doctor for 5 minutes,
right?
5 minutes. And a lot of times the support people are listening to the fetal heart, are doing their blood pressure, doing everything, and they're not even having that time with the doctor.
No.
Like for myself too, I'm doing their blood pressure, I'm drawing their blood during their appointment or whatever needs to be done, but I'm doing it and can communicate and observe them and talk to them during the appointment, and they're never waiting. Like I schedule my appointment so nobody's waiting. So so the time that you're spending is not any time wasted time. As far as I had some woman, because I'm licensed in New York too, in New Jersey. So I had a client that came to me from Queens. And she would say to me, it's taking as much time. I would maybe drive, 20 minutes to go to the doctor's office, but then sit there for 2 hours and then see them for 5 minutes. And then at least with you, it might take me, depending on traffic or the time, it may take me, 45 minutes, an hour to get to you, because we tried to schedule appointments so she doesn't run into too much traffic. But anyway, so with that, she would say, then I would be with you for an hour. So I still had the same amount of time spent but I was spending that hour with you instead of spending 2 hours waiting in the doctor's office, to speak to them, to see them for 5 minutes. So.
Yeah. I mean, and I just, that just to me is also so disrespectful of your time that, with the scheduling is double, triple booked. So, there's this huge wait. Like nobody wants to wait in a doctor's office. And, I don't understand why they, I guess they're doing that in case somebody is late or doesn't show up for their appointment, but it's just still like really not that. It goes back to just not valuing that woman's time, not valuing if she has questions. They're so rushed. It could be like, okay, I don't have time to actually answer your questions. And it's almost like this, like your questions aren't important. I'm running the show. This is how we're doing things. And there's no opportunity to have a dialogue.
Right. And they're not being seen, too. That's the whole thing, I believe, too. They're not being seen. And I think so many times women are not seen or heard, and they're not being seen or heard. And that is really sad.
It's very sad. And it speaks to a cultural issue, right? Like this isn't even just related to pregnancy and birth, but in general, women feeling that this is an acceptable way to receive medical care because that's what we've been taught since we were little girls.
Right. Exactly. And, sometimes I think I've had clients too that maybe thought that, okay, this time when we're talking about insurance and out of network, that they would, okay, well, I'll just see someone in network. And then they come back and they realize that wasn't the experience. They realize the experience that they're actually getting, like with me, as opposed to like, I'm just going to, because sometimes they don't, if their appointments have always been like this, they don't know the difference in how other people, what they have to put up with.
Yeah, no, that's true. And I mean, even, myself, my practice is out of network and we'll have people call in and say, oh, do you accept my insurance? No, we do not. Here's a super bill. And they'll be like, okay, well, I'm going to call another office to find who's in network. So like that's their highest priority because of the cost savings, right? It's less out of their pocket. But you have to say like, well, what are you really saving here when you're paying, your quality is potentially suffering when you have less out-of-pocket expenses. And that's the beauty. People complain like, oh, insurance doesn't cover anything anymore, nothing holistic or preventive. It's like, well, insurance is really meant for catastrophic care. And if you need something catastrophic, thank God for insurance, right? But when we're talking natural and, less invasive, then that's where HSA and FSA accounts come into play. You put this money away tax deferred, and that covers these types of expenses, including a home birth, for example.
Right. Because as far as with insurance, I mean, the insurance reimbursement has gotten so much worse. Because I'm out of network, but I mean, it's gotten so much worse than from when I started the practice. Also, like 10 years ago, I was getting twice as much money reimbursement from insurance companies as an out of network provider than I am now. And I'm fighting twice as hard. Like I didn't have to have a biller before. I could just, do my own billing. And now I have a biller and they're writing all appeals. It's really, really sad.
It is sad. I mean, I remember, 4 years ago when you were at my birth, we were having issues getting the insurance to cover it. And, I was during the pregnancy, I'm on the phone making these phone calls. And they're kind of like, well, why can't you go to an in-network provider? I'm like, because there are no in-network home birth midwives. They don't exist. And it's just like, well, then why don't you give birth in a hospital? It's like, it's just, and I'm talking to an insurance person, right? Like Like, what? Like, this is like not even appropriate for you to be making any recommendation on my care. And how is this that, the insurance company is like, why are you giving birth at home? So that brings me to my next question. Home birth in the United States is relatively rare, right? It's around 1% of births. But I was reading an article recently that because of the pandemic, more women are choosing to give birth at home. Can you speak a little bit to that?
Yeah, when the pandemic first struck, I guess I would say, I and like all the other home birth midwives that I know were like bombarded with inquiries for home birth. I mean, I was getting text messages, emails, phone calls that women were panicking basically and wanted home birth. We really couldn't handle the demand at that point. I already had clients that were, that, like I said, I have a small practice and I already had, I had my numbers, but I did take on a few more clients that were very good candidates and had did beautiful home births. But it was like very, it was very overwhelming for us, and just overwhelming to have to say no to somebody. Also,
that's hard. That's really hard.
It's really hard to say no. But like I had to honor my obligation to my other clients also. But so we had we did have a lot of people. We were able, I don't want to keep talking about it, going back to insurance, but we were able to get some in-network gap exceptions to get the women covered because of COVID. It wasn't really funny, but they're one of the insurance companies that when I spoke to them on the phone, we're like, of course, it's COVID. Yes, that's, and you're in New Jersey. Yes. Okay. Yeah. We'll cover it as, and we got the letter and the whole thing. And then it took me a year to get paid on her.
Wow.
Because we didn't want to cover it in network. They kept saying it was out of network. And so, I mean, if we could get the cooperation of the insurance companies to work with us better, more, and then we would have even been able, I think, to handle more during the pandemic.
Yeah. And at the end of the day, especially in the beginning, when there was a huge stress on the hospital system regarding the actual virus, right? For low risk women to not be around and have exposure and not stress that hospital system anymore, it's just so logical to me.
Oh, yes, I know.
I'm so excited to share with you a company I recently discovered called Kindred Bravely. It came into life in 2015 by Deanne Ackerson and Mama 2 when she couldn't find any comfortable or functional pajamas while nursing her second son. She decided to design her own, and this led to one of the best-selling pajama sets, the Davy Nursing and Maternity Pajama. As moms, we have to stick together, which is where Kindred comes from. And Bravely, being a mom can be super tough. It's not for the faint of heart. It takes a lot of courage, and that's where the name came from. At Kindred Bravely, they are devoted to making life easier for pregnant and nursing moms. From breast pads and non-skid socks to nursing bras and pajamas, Deanne creates every piece with comfort, beauty, and function in mind. And her designs have been recognized by multiple awards. Perhaps more important than her clothing is Deanne's mission to build a community of moms who support and celebrate each other. Go check out her website at kindredbravely.com and use the promo code WELLADJUSTED20 to save 20% off your purchase. And I remember doulas weren't allowed in those.
Right, I was going to say that, yes.
So that's huge. I don't know how I would have labored, without my doula. So I can't imagine having, to pick between my husband and a doula at my birth. And who wants to labor with a mask on their face? Stop it. I'm like, that's ridiculous.
Oh, yeah. And with that too, is you had, and then you can only make a decision. All right, I had some hospital clients at that time too, that were already, hospital clients to begin with. And I mean, the lucky thing, I'm going to talk because I was I have privileges at Pascagoula Valley Hospital. The lucky thing for them was that L&D and Mother Baby is on the first floor. And they have windows in all the rooms because they're on the outer the outer, I guess, layer of the hospital there. And I had one client who is an Orthodox Jewish woman that she could only, you can have your doula, you could have one person. So her mother-in-law and her husband were looking through the window during the birth because she wanted to have her doula with her because of, like with the contact that her husband couldn't have with her too during the, for labor. So, I mean, it was really, really hard for women to make, to come into the hospital, like basically by themselves, or to be, and to be thrust into that type of an environment too, where they couldn't have the support people that they needed or wanted, or especially under a pandemic situation, you want more support then, and they couldn't have the support that they, were looking for. And I mean, we had doulas like, using laptops to be in the room with the woman, or, being at the
for like FaceTime.
Yes. Yeah. To like, they were coming up with creative ways to try and communicate during the labor with them.
I can't imagine. And there was so much, I mean, there still is so much fear that we're surrounded with. Like, that is the last thing you want to be mentally dealing with when you're giving birth. You want to feel safe. You want to be able to surrender. You want to open, and you can't. I would feel like that must be so much harder to do that.
Yeah, and you couldn't even, like before, like if you could walk around, because they have the wireless monitor, so you could walk in the hallway when you're in labor if you needed to be monitored. I mean, if there was no medications, you don't need continuous monitoring. But say the woman was on Pitocin, let's just say, for an induction, she could still walk around. She could still, but now you had to stay in your room. I mean, you still have to stay in your room. That's the way it is. But it was so isolating before too, because even the partner or with your birth support person had to, once they came in, it could only be that person, and that person had to stay the whole entire duration. Like, they couldn't leave and go home and feed the dog and come back or switch or anything.
That's hard. That's really hard. So, I mean, women are still giving birth. We even have pandemic babies that have been popping up in the past few months. So, it's interesting. I mean, how do you feel like now, even we're over a year and a half into this pandemic, are still women choosing home birth at a higher level than pre-COVID?
I think they are still. There's more of a inquiry about it. I think maybe like as time goes on, I mean, things have gotten now a little more lax at the hospital. You can have the two people, and the doula is considered part of the healthcare team. One person, but the doula is considered part of the healthcare team. So the doulas can be there, and one other support person. So, I mean, things have gotten a little bit more, but you're still stuck in the room, and
you're stuck in the room. Although, like, the other thing I heard recently was, if you, as a pregnant woman, if you're getting if you have a negative COVID test, then you can labor without a mask.
Right. Yes. Yeah.
So that's hugely helpful. Everyone else around you is wearing a mask,
right? Exactly.
But the laboring woman, like, she needs to breathe. So I'm happy to hear that mask has been lifted.
Yes. Yeah. That's it. Yes. And everybody gets a COVID swab when they come in. Yes. So, yeah. Yeah. So, I mean, yeah, it's really a difficult thing. But I think still the thing that the issue is with the insurance companies, that women are, still concerned about the cost of a home birth. And it's getting like, there's another, I've taken on teaching students, which I did before, but I've taken on more groups of Rutgers students just to make ends meet really on my end. It's really, really difficult. Like I said, I'm getting paid like a year later for things. And maybe it's just me, but it's very hard sometimes to like collect from people. And it just makes it difficult. But I guess people need to, what you mentioned before is like, about realizing the value that they're getting.
This is huge value. And I definitely want to have you emphasize that. It's huge.
Yeah, the value. And two, I mean, people will spend money on the wedding experience. Like, this isn't really a big experience in your life. Most women, most families, they just have a few children, maybe one, two, and so that experience and how you experience birth and your pregnancy is like a really big deal, and then you'll spend $50,000 on a wedding, but you don't want to spend $8,000 for a birth, that kind of thing. It's really to look at and what you're getting for them.
Yeah, I feel like it's invaluable. And I think it's very important to have that perspective. This is not like an annual expense for most people, right? And, at the end of the day, yeah, it's a few $1,000s possibly out of your pocket. But it's just worth every penny to be able to have a birth in a place that feels safe by a practitioner, a provider who knows you and is there fully to support you and helping you achieve the birth that you want. And is really helping you create an empowered birth experience. My philosophy is when women have empowered birth, it's really transitioning their level of consciousness and really helping them transition into a conscious motherhood, which will impact them the rest of their life in parenting that child. So this isn't even, we're not talking about just like a one-day event here either. We're talking the rest of your life and the rest of your child's life is impacted by this birth. That's a big deal.
Yeah, I can just talk from personal experience too, in that my oldest child, my oldest daughter, she's 41 years old. And I had another child at 39. Who's 39, excuse me. And then my youngest is 37. But what happened was I had the first two at the hospital with doctors. And I can still remember, I'm talking that's why I'm sharing this, because at 41 years ago, I can tell you my whole birth experience. I can explain to you, and I can also tell you what was done that was not in my best interest and in making my birth experience the best. I had episiotomies for the first two, which were totally unnecessary that I know now. But my first one, I had no idea. And then the second one, when I was pregnant, I remember talking to the doctor. It was a group. There was three male doctors. And I said to him, one of the doctors, I don't want to have an episiotomy next time. I don't want an episiotomy. And the doctor had said to me, just remind us in the delivery room. Well, I got to the hospital, the second baby, 10 centimeters dilated. In those days, you went to a delivery room and then they moved you to a birth, like a delivery room. You went from a laboring room to a birthing room. Anyway, I got undressed and went right into the delivery room, and I pushed 3 times, and everything was happening so quickly, and I pushed 3 times and she was out, and then he still cut a damn episiotomy, which was totally unnecessary. And I still feel so violated by that.
I hear that.
Today, but it did change my life in that then with my third child, I was in my 8th month of pregnancy. And I went to the doctor and I was asking questions and he just couldn't answer my questions. And then I was thinking, I was like, this just isn't right. And I looked into, I said, there was a birthing center then. There was a freestanding birthing center in Englewood. And I was like, I'm going to see if my insurance will cover that. And we had Blue Cross Blue Shield at the time. And it did cover my birthing experience. So in my 8th month of pregnancy, I switched over and had a birth with a midwife at the birthing center where I had no episiotomy. I called her at 6:00 and said, I'll be there at 8. And my baby was born at 9:54 p.m. And my baby didn't leave me, didn't go to the nursery, didn't go anywhere else. My baby was with me the whole entire time. And I went home 12 hours later. And it was the most empowering experience to me. And that's why I'm a midwife today. It's like it can really impact your whole view and your life. And I also think of whenever things are really difficult, that if I could get through natural childbirth and that experience, that I carry it with me to this day. Like that being able to just, I don't want to say accomplish that, but just to go through that process and that experience is, I, as an old lady now, I'm 62. I still
You still carry that.
carry it with me. Yes.
That speaks volumes. So I'm so grateful for you to share that story. And just so women know, like, even if you've had previous birth trauma and experiences that you felt violated or disempowered, there's still an opportunity to heal.
Right. I mean, and sometimes, things don't go, there's like no guarantee.
There's no guarantee.
There's no guarantee. And if things didn't transpire, because I have had women that I have, that we had planned a home birth and we have transitioned to the hospital, and they still had empowering births. And I guess sometimes though too, we want to talk about the good stuff and how everything was very empowering to us. But I think sometimes if someone does end up with, they planned a home birth and then ended up with that they had to have a C-section, that's a whole other story. I know, but I think sometimes it's almost like too, when we say breast is best, and then if somebody can't, if for some reason, can't successfully breastfeed, then they feel like they've been cheated. So I don't know.
Yeah, I would say an empowered birth is not always a natural, unmedicated birth. That's the bottom line. But it's still coming from a place of empowerment, even if the end result is a surgical delivery.
Right, because if you're given choices and you're told and you've been able to know, why is this happening, or what will you do, and what are my options? Because I think that's the important thing, is that women know their options.
Definitely.
And yes. So.
Always. Well, Carole, this has been such a pleasure. I'm so happy that I got to have you on the show today.
Well, thank you. I've enjoyed it too. So thank you.
Thank you. Well, I hope today's episode was inspiring and empowering you to learn more about your options regarding birth location. And there are other places for giving birth outside of a hospital for women that are healthy and low risk. So look up your options and come from a place of empowerment instead of fear.